If the evidence is so clear, why are millions still sick? Because the truth about food and your health was hijacked. This video will show you why the system is broken and how to escape it. Hi everybody, my name is Marc Bates. I'm a metabolic health coach, and this is part of my question and answer series. Why the health system keeps you sick. The truth about nutrition they don't want to admit. Alright, let's go to the question that brought this up. You've called this a systematic indictment and mentioned that the human cost has been staggering. But here's what I'm wrestling with. If the evidence is so clear that animal-based nutrition works and our guidelines are fundamentally broken, why do you think the medical and nutritional establishment continues to double down on recommendations that are clearly failing people? Well, this is the ultimate question. This is the heart of the dilemma that we're facing as a country and pretty much worldwide. And it's not just frustrating for me and you, but it's also tragic that this is happening. The evidence is accumulating, the testimonies are compelling, and yet the institutions responsible for health policy dig in deeper. Why? The short answer: science isn't always scientific when systems are political, reputational, and financial. Follow the money, as I always say, right? But let's break it down more precisely. Alright. 1. There is institutional inertia. Systems protect themselves. Medical and nutritional institutions operate like bureaucracies, not agile truth-seeking machines. Once a guideline is published, especially on a massive scale, like the 1977 U.S. dietary goals, right? And by the way, right, that was very similar to a Swedish goal that became prominent in the EU. And if you look at third world nations around the world, they have, some of them even have written into their constitutions that they will automatically accept whatever the USDA puts out as dietary goals for their populations. That's how much the U.S. was seen as the official arbiter of truth here, right? That's scary. Okay, this stuff becomes an institutional dogma, right? And entrenched dogmas are not the truth. They are what keeps the powers that be in power, right? Careers, reputations, grants, and entire public health frameworks became tied to that foundation of what was dogma, not what is truth. Changing direction isn't just inconvenient, it threatens the credibility of the system. We can't reverse the Titanic without admitting we built the wrong ship, right? Okay, there's also industry entanglement. Food, pharma, and profit from sickness. And I always say, follow the money. The processed food industry thrives on ultra cheap, shelf stable, seed oil laced, high carb products, right? And the pharmaceutical industry depends on a chronically ill population. Type 2 diabetes, heart disease, obesity, fatty liver, depression, these are gold mines when managed, not reversed. Animal-based nutrition reverses these conditions. That's a threat to recurring revenue. It's not a conspiracy. It's a misaligned set of incentives. 3. Nutritional education is corrupt and incomplete. Most physicians receive fewer than 20 hours of nutrition education in medical school. And what they do is often filtered through industry-funded paradigms, right? Also, just go back to when you were in college. How much did you really pay attention to those classes that were mandatory classes that had really nothing to do with what you were trying to be, right? So if you wanted to be an emergency room surgeon, right, the nutrition classes are mandatory. You may not pay that much attention to them, quite honestly, because you need to focus in on all that stuff to become an emergency room surgeon. And God bless people who go through all of that. Right? Doctors are very important people. They want their patients to not be sick. They don't want to hurt people. But they're trained to do something very specific. And it's not what nutritional therapy is all about, and holistic health care, and getting to the root cause of diseases. Okay? So, what happens is, as a result, doctors are trained to manage symptoms, not address root causes through diet and lifestyle. That's because they're trained. The allopathic method, right? You have a symptom. You give a diagnosis of what that symptom is. You prescribe something to treat that symptom, and then you manage that. That's allopathic care, right? Well, that's great if you have a broken arm from being in an automobile accident and somebody has to fix the broken arm, and then you get better eventually, right? Or you have an emergency and they need to perform surgery on you to fix something. That's where allopathic care has second to none. But you go to your doctor and you say, my blood sugar's too high. You have a symptom. He's going to diagnose it. Well, you're pre-diabetic. I have a medication for that, metformin. Let me give you metformin. Oh, by the way, here's also a little nutritional pamphlet from the American Diabetes Association, right? Who's funded by Big Pharma and Big Food, and they still say eat lots of carbs, right? And then we'll manage it. So come in and see me every quarter, and we'll take more blood sugar samples, and when your blood sugar goes out of whack again, some more, we'll up the doses of the medications and all that stuff, right? So they manage it. They don't cure it. Excuse me, cure is the wrong word. They don't reverse the diabetes, okay? There are doctors, and you can find them now, who have broken from the system. So you look for doctors like Dr. Tro Kalayjian, Dr. Sarah Halberg, Dr. Chris Palmer, and Dr. Ken Berry. These are guys who have broken from the system. But here's the problem. For them to literally break from the system, in many cases, they have to break from the hospital alliances that they're part of and their medical groups, because they have systems and procedures that they have to follow to be part of those groups, which require them to diagnose in a specific manner, to promote specific types of pharmaceuticals, right? So follow the money, okay? So despite, everything that people have gone through, understand your doctor doesn't want you to be sick. They're just not trained to deal with you on a holistic level, okay? That's the general rule there. All right, tribalism and academic ego. Science is supposed to welcome skepticism and revision. Yeah, that's the truth. And when I was taking hard sciences, that was the whole idea, right? But in nutrition, dissent is often punished. Researchers like Tim Noakes, Gary Fettke, or Nina Teicholz faced professional backlash, not because they were wrong, they were actually extremely correct, right? But because they challenged orthodoxy, okay? And let's be honest, it's hard for people who built their careers on fat is bad or meat causes cancer to admit they have harmed people, right? Not everyone's willing to do what Dr. Tim Noakes did. Write a book following all the standard stuff about how to perform better as a runner, and then take that book, which was a bestseller, right, and literally rip it apart on video saying, I wrote garbage here, and I'm rewriting this, and I'm putting the correct information in, right? That's very difficult to do, right? I've got this quote from Upton Sinclair. It's difficult to get a man to understand something when his salary depends on his not understanding it. Just keep that in mind. Follow the money. Think about what difficulties your doctor is in. If he belongs to a medical group that is forcing him to do things in a specific manner to protect the medical group and himself and all kinds of other reasons, right? There's lots of good reasons for this, but is it really how you're going to get the healthiest you can be? We'll think about that. All right, I love this little video. Cultural programming and ideological capture. Right? There's secret societies and everything. Right? Many people, including scientists, are not driven purely by evidence. They're driven by beliefs. The plant-based movement taps into powerful narratives: purity, nonviolence, environmentalism, and the distrust of corporations. Ironically, while eating corporate-produced fake meats. These beliefs often override biological reality. When nutrition becomes a moral identity, it becomes nearly immune to actually looking at the data. Okay? So, enjoy this little video. Okay. So the question is, why do they double down? Because the reverse course would require the establishment to say, we were wrong, we made you afraid of meat and fat, we encouraged whole grains and seed oil, and in doing so, we contributed to the rise of obesity, diabetes, Alzheimer's, infertility, depression, autoimmune disorders, and more. We told you to fear the very foods your ancestors thrived on, and it made you sick. Can you really imagine? Big pharma, big food, big medical, big insurance actually saying that? Follow the money. That kind of humility is rare in institutions of any kind. Okay, but there is still hope. The cracks are widening. More doctors are going low-carb and carnivore because of patient outcomes. More people are sharing stories like Michelle Hearns, right, who was almost died following her own advice, and then she changed it all, right? More independent researchers are exposing the flaws in nutrition, epidemiology, and right, which is how almost all the studies are done, which is a very flawed science for coming up with nutritional evidence. And the grassroots movement, fueled by real healing, is growing. Truth doesn't need permission, it just needs repetition. All right? So it's there, the truth is there if you're willing to find it. I want to thank you for watching. If you have any questions at this point, you know where to leave it. If you have a comment, put that there and put that in the same place. This is a community. I'm here to try to give you the information you want. If there's something I'm not covering properly for you, or you want me to look deeper into, let me know. I love producing videos that people ask for. All right? And also, if you haven't done so, like, share, subscribe to the channel. It helps the channel out a great deal, and you might help somebody by getting real information in their hands. I do appreciate it. Thank you very much.